paramedics are bringing in a 17-year-old boy with gruesome injuries.
This is Santi or Santiago.
Hello, my name's Ben. I'm the nurse in charge tonight.
The American schoolboy stumbled and plunged 10 metres down a cliff.
Ready, set, go. And
That was so painful.
yeah, I'm sorry, mate. Obvious injuries is he's got a compound lower third humerus there on the right side. That has just started hemorrhaging about the last 5 minutes, and he's got multiple abrasions.
Trauma doctor Lauren Cohen has only been in emergency for a few months.
Can you wriggle your toes for me? Good. Feel me touching you there?
Yep.
And there. And there.
It's always very busy, always hectic. All the different staff have to work together to get the patients seen and assessed and treated really quickly. So it's pretty chaotic, but the emergency department has a great spirit.
How's your health normally? Do you have any medical problems?
No.
When someone has a really obvious injury, it's easy to get caught up in that injury and forget that there could be other injuries we don't know about. So our immediate concerns are about protecting the spine, making sure the patient's able to breathe and getting enough oxygen, and that they're not bleeding massively. So those are the immediate things that we worry about.
Santiago has snapped the bone in his upper arm in half, and under the bandages, it's poking through the skin.
Yeah.
Do you take any regular medications?
No.
Oh, beautiful. And when did you last eat or drink?
I had a Big Mac for lunch about 10 o'clock.
Oh, that'll keep you going for a while.
Santiago is alert and oriented and talking to us, and I'm really relieved to see that because it immediately tells me that his brain's working, his heart's working, and we can actually see some of his personality straight away.
All right, they're just having a look with the ultrasound at your belly, and while they do that, I'm just going to do a bit more of a thorough look over. Just going to have a look at your eyes. Got a bit of blood coming out of your nose. I think. Breathe in from it.
I got much more involved in Santiago's case than I normally would as a floor coordinator simply because he's 17. Broken bones don't necessarily sound bad, but a badly broken bone to a dominant hand can have a huge impact on someone's life.
Send everyone to step away while we do chest x-ray. X-ray in wrist or spine.
It's been a horrible day for Santiago, who only moved to Australia from the US 6 months ago.
Going to give you some pain relief. We'll give you a little bit of a head spin.
Santiago's schoolmate Jack was with him when he fell and can't believe what's happened.
I tried to stay calm, to keep him calm. I told him, focus on his breathing, just try and distract him from his arm. We see each other every day. So, yeah, gotten to know him pretty well.
We're going to do that roll on the side now.
Is everyone ready? On 3, 1, 2, 3.
Okay. Yes or no? Do you have pain, Santi?
No.
Pain where Lauren's touching?
No.
We haven't found any obvious injuries in Santiago apart from the fracture in his arm, and we haven't found any evidence of any head or spinal injury.
Do you have any pain where Lauren's touching?
No.
Our major worry is this pretty nasty open fracture that he's got, which means that the bone's sticking out of the arm, and the arm and the tissue could be quite contaminated.
Bleeding quite a lot there. I'm going to stop that first.
What's bleeding?
Sorry. Your arm.
It is the right one.
Yeah, but there's quite a lot of blood there.
Over in Resus, Dr. Lauren Cohen is still treating 17-year-old Santiago after he plunged 10 metres down a cliff.
1, 2, 3.
Oh.
Good man, well done.
It does worry us that there's so much blood coming out of this fracture. Open fractures can bleed a huge amount, and so we need to get on top of treating that. Santiago has broken his arm in the mid-shaft of his humerus, which is the bone in the upper part of the arm. There's some really important nerves that wrap around the humerus in the arm. In particular, one of the nerves is the radial nerve that controls a lot of the movements in the hand, and that can very easily be damaged in this sort of injury.
Oh.
Right-handed Santiago is in his last year of high school, and any nerve damage could ruin his chances of graduating.
Can you give me a thumbs up? Beautiful. Can you spread your fingers out like a star? Good. Well done. Point that finger up for me. Keep it there.
An open fracture means that the bone's sticking out of the arm, and because it's being contaminated, and there's a really high risk of infection if we don't get onto it quickly and get it washed out and put back into a position where the tissues are protected.
So we're just going to give you some of that medication now, which will just make you a little bit sleepy. Nice low breast volume.
While the team wait for the sedation to kick in, Santiago's mate Jack, who was with him when the accident happened, waits anxiously outside.
He fell probably about 10 metres and landed at the bottom, just yelling up, "I've broken my arm." So I was concerned about that as well. I was like, this could be very bad.
Oh, still good.
Doing really well.
Grade 1.
It's pretty nasty compound.
It's a very contaminated wound. He's fallen down a cliff and arm tissues are all open to the environment. If we don't get on top of the potential for infection in this arm, he could end up with really serious infection in the bone.
Did you have all your immunisations at school? Or do you know when you would have had a tetanus shot?
Yeah.
I have no clue actually.
Giving it a bit of a clean. Doing really well.
The team need to push the bone back inside the skin and then put the arm in a cast to keep it straight and protected.
Does Mum know you here?
In the hospital?
Yeah.
No. I'm living with my aunt and my uncle.
Do they know you here?
No.
The teenagers' parents are on the other side of the world and don't know about their son's horrific accident.
Is Jack still there?
Who's Jack? Is that your mate? He's in the waiting room and we'll get him in once you've had your CT.
There's a chance that Santiago has damaged his radial nerve with this injury, and that could mean that he could permanently lose some of the movements in his hand. For a 17-year-old, that could be quite a life-changing injury.
1, 2, 3.
Oh boy. Oh boy.
17-year-old high school student Santiago fell 10 metres down a cliff.
Oh, it feels so up.
He's about to have a CT scan to find out how badly broken his right arm is and whether the break has injured nerves or blood vessels.
Ooh, his arm looks not nice. It's all smashed, I think.
After the scan, best mate Jack is finally allowed in to see his friend.
Heyo.
Thank God,
This is the infamous Jack.
How are you feeling now?
Okay. Do you mind, like, scratching my eyelids?
Which one? Both of them?
Oh, more. Oh. Thank you.
The nurse was saying that she was impressed by you.
But in what way?
By your arm.
Oh, really?
Yeah.
Sick.
Santiago hasn't told his parents in the US about his accident. They're about to get a frightening phone call.
Hi, Mom. I'm sorry, I didn't mean to wake you up. I just have something to tell you, and it's really important, and I really need you to not freak out, okay? I fell about 10 meters down this really rocky hill, and I broke my arm really, really, really badly. They're taking really good care of me. My friend Jack is with me. It's my mom. She wants to talk to you. Yeah.
Hi, Karina. My name's Ben. I'm the nurse in charge at Royal Melbourne ED. It's a pretty confronting thing that's happened. I can't imagine a more disruptive phone call at 3 o'clock in the morning across the other side of the world. So I really did want to give her some reassurance and make sure that his mum understood that we would be able to look after him.
You're good, man.
The CT scan results are back and show Santiago urgently needs major surgery to repair his badly broken arm.
We're going to find the fracture, find the bone, get some clamps, put it together, and then we're going to use some plates and some screws to hold it all together. Okay?
So, recovery time?
Recovery time is a while. You won't really be lifting anything for up to 3 months. Okay? It's going to take a while.
Yeah, we're looking after your arm.
It's been 2 days since schoolboy Santiago was rushed to hospital after plunging 10 metres down a cliff, snapping the bone in his upper arm.
Pretty nasty compound.
The brave 17-year-old had an operation to realign the broken bone, which had pierced through his skin.
I had a surgery the next morning to put some metal plates on this part and this part of my arm, and then they put screws going along. So now we're just waiting for them to heal properly.
Santiago's on strong pain relief, but today he's ready to go home.
I have plans to hang out with some friends today when I get back, and I'm going to school tomorrow.
Right-handed Santiago still has a long recovery ahead, and the impact on his life will be dramatic.
I'm gonna have to learn to use my left for everything, and I also work at a pizza shop, which I think that's a done deal because I'm not gonna be able to lift pizzas out of the oven anytime soon.
The Year 12 student hasn't lost his adventurous spirit.
From now on, I'm definitely gonna stick to the bike paths and not go off trail too much for the next couple of weeks at least.
Over in triage, 58-year-old electrician Roger has arrived with paramedics after falling through a ceiling manhole.
So he's fallen through the roof onto the ground?
Yeah. Looks like the ladder slipped out from underneath him.
Nurse Lucy Stranger is assessing patients this evening, and her job is to find out if Roger needs immediate attention.
Hello, can you open your eyes for me, matey? I'm over here. I need to check his level of consciousness. And if that's at the highest level, which is at 15, that's brilliant, totally orientated. But if it sort of drops off, it can be that there's something going on internally. Roger. Roger?
The tradie is showing worrying symptoms and is being taken straight to trauma, where Dr. George is standing by.
Roger, I'm George, one of the emergency doctors here. Clearly, you look like you're not feeling too crash hot today.
Where's that pain, mate?
Roger's a 58-year-old Sparky. He had an unwitness fall. He's got a graze on the inside of his right bicep, which is consistent with having his arms above his head. He's got a sore left shoulder, sore left hip, which is not complaining of any headache or cervical neck pain. It's always been lumbar pain.
Excellent, thank you very much. Fall off a roof from several metres up, you impact usually on concrete with absolutely no, safety device to prevent injury. The kinds of injuries I'd be typically expecting in his chest, usually some broken ribs, some lung contusions, maybe some spinal injuries, maybe a pelvis fracture, and maybe he's got a limb or two that's broken. Can we get in some oxygen, thanks? Yeah.
Best mate John was with Roger when he fell.
We're at my son's house, just trying to finish off so they can shift in. And he's had to go up in the roof and put his bladder up in the manhole. And I think as he was walking up, it slipped out and he's obviously fallen down and done a bit of damage to himself. Yeah, a bit of a shock.
Can you feel me touching your feet? Yeah. Any numbness or tingling? Nah.
Roger can feel his legs, but it doesn't rule out spinal injuries.
Yes, if there's pain, or no, if no pain.
So we're going to try and get some x-rays. So if anybody's not wearing lead, can we start migrating out of the room? Thank you. So his x-rays actually weren't too terrible. Looked like he might have some left-sided chest injuries, but you don't get a lot of detail on your simple x-rays, so...
John will be here for when you get back from your scans, OK?
And while Roger seems more alert, he could still be seriously injured.
What we're going to do now are some CT scans all the way from the top of your head all the way down to the bottom of your pelvis. One of the things that's the most disturbing for all emergency practitioners are talk and die patients. So the idea that somebody seems to be well and then deteriorates. They're a rare population, but they really stick in your mind. And, you know, if you've ever seen a situation like that, you become very vigilant about making sure, yep, this is probably just the same as all the other trauma patients, he'll be just fine. But I need to make sure we're not missing any life-threatening injuries.
Dr. George Plunkett's patient, electrician Roger, fell through a ceiling manhole, landing on concrete.
He's going to have broken something, probably a few things. So we will do a CT because he's landed on his head and his abdomen and his pelvis, because that's where most of his pain is. At the end of that, we'll have a hell of a lot more idea of exactly what his injuries are. Then we'll be able to come up with a plan of how we make him better.
Okay, starting hot injection now, nice and still.
Please breathe in and hold your breath. Pelvic fracture, let's see. Any pelvic fractures? This looks alright. Looks pretty good. Yeah. No pelvic fluid, which is always a good start.
Roger's pelvis looks okay, but injuries to his back are severe. There may be bone fragments which could sever the spinal cord and lead to paralysis.
So, Roger.
Yes.
I thought I was for sure going to see some pelvic fractures, but I couldn't see any, so that's really good.
That's fantastic.
We're not yet out of the woods, though. Our radiologists will go through it with a fine-tooth comb.
Mm-hmm.
So we'll know over the next couple of hours that we're not missing anything.
Yeah.
Roger's future as a self-employed electrician could be at risk.
Yeah, Roger.
You're not bad, John. Appreciate coming in.
Roger was helping his mate John do some work on his son's house when the accident happened.
Sorry I fell.
Oh, Jesus. Just as long as the pain goes away.
He's a good man, a good friend.
That's what I'm looking for.
Just in the hips and bottom of the spine.
58-year-old Roger is still in severe pain after falling through a manhole. He's waiting to find out from Dr. George how badly damaged his back is and whether he'll walk again.
Now, so Roger.
Yes.
The radiologists have had a chance to have a look with a bit more detail, and they've spotted that you've managed to break a couple of bones in your back. So one of those is a bit higher up, kind of about the level of your shoulder blades. And that one, to my eyes, as a non-spinal expert, looks like it will heal up fine. There's one a bit lower down. That one does look like it'll need surgery to stop the free bits of bone wiggling around it. We're letting the orthopaedic spinal surgeons know about you to help come up with a plan for you.
Okay, thank you.
Okay? Roger's got what's called a burst fracture of his vertebra, so the main part of his vertebra has essentially exploded. And that's, you know, what we would call an unstable spinal injury. So that means that bony fragments can shift around and are unlikely to heal, you know, rapidly and well without needing some surgery.
For Roger, his worst fears have come true.
It's a day-to-day reminder that life's fragile and, you know, somebody can be perfectly well in the morning and not a couple of minutes later. It makes you appreciate what you've got and to make the most of what you have.
Dr. George's patient, Roger, survived his 2.5 metre fall from a manhole. The self-employed electrician broke his back and needed spinal fusion surgery to repair the damage. Roger was released from hospital a week later, but sadly hasn't been able to return to work.
A 35-week pregnant woman's had a fall from standing height. She's got some mild facial trauma. She's hit her abdomen. The only thing is that her heart rate's 120. I don't know why.
At the Royal Melbourne Hospital, emergency doctor Miriam Yasser is preparing for a high-priority case. A pregnant woman being brought in by paramedics.
So all pregnant women that have been involved in a trauma would to Royal Melbourne Hospital because we're right next door to the Women's Hospital. So if there is any concern of safety to the mum and baby needs to be delivered quickly, the obstetricians are on hand to make sure that that can happen.
Hi, how are you going? I'm Miriam, I'm one of the ED doctors. I'll be taking the handover.
Yep, go for it.
Okay, this is Jonah. She's a 29-year-old female who is normally fit and healthy. It's currently 35 weeks gestation. This morning she has been at railway station. She has been witnessed by other commuters to have a standing height unconscious fall, falling forward on the train platform, landing on her face and abdomen. She was on her way to an obstetrics appointment. She does have a dark gravel mark on her shirt just above the abdomen. She has swelling around her left eye, cheek and left eyebrow there, and also an abrasion to the back of her left hand.
Thank you very much. Hi, sweetheart. Hello. What a morning. So what do you remember?
Nothing at all. Just I remember in the train station waiting for my train. Then the next thing I know, people are helping me.
All around you, yeah. So you had no warning that you were going to fall on the floor? No.
Why has she collapsed suddenly? Is it something to do with her pregnancy? Has something gone wrong?
Can I get a blood sugar as well as an ECG, please?
It could be that there's something structurally wrong with the heart. Could be that there is an irregular beat. Could be that the electrical circuit of the heart isn't working the way it's supposed to.
Does your husband know that you're here?
Yeah, I think he's on the way now.
He's on the way.
Yeah.
That looks good to me.
Jonah's heart might look okay for now, but will need further tests. In the meantime, Dr. Miriam turns her attention to the unborn child.
Now, what baby is this, a girl or a boy?
girl.
A little girl. Oh, that's nice. Have you had any bleeding?
I don't feel anything.
Okay.
I think not.
She hasn't felt baby move and it could be quite serious. We obviously need to make sure that the placenta's okay, that there's no bleeding.
And your first baby?
Yes, under IVF.
Under IVF, okay.
Anytime I'm responsible for a pregnant lady like this, it's really, really scary because there is potential for a life-threatening injury for baby.
I'm just going to do a little scan of your belly, okay? All right, my darling.
You haven't felt any contraction-type pains or...
Dr. Miriam Yasser is doing an ultrasound to see if the baby has been injured in the fall.
This baby is an IVF pregnancy. It has been difficult for her to conceive. And so for there to be something potentially wrong with baby would be a really worrying thing for her.
Which side is baby lying?
Mostly she's here.
There she is. Look at that. Can you see that? Yeah. See that there? That's her heart beating. Beautiful. That looks really good to me, that everything is okay.
For the moment, baby is okay, but we need to further investigate what's happened to Jonah that's caused this collapse.
Is it sore up here? It's sore there. Darling, what we need to do is we need to do a scan here of your face to make sure that nothing's broken and the eye's okay.
We know that she's injured her face and we know that her heart rate's really high.
Please breathe in and hold your breath.
So the most concerning thing in a scenario like this is still that there's something wrong with her heart. We've done some basic tests like an ECG and a quick ultrasound, but that doesn't mean that there still might be something going on. She has to be investigated by our cardiology doctors and monitored for a period of time.
Waiting in the trauma bay is Jonah's husband, Darren.
I just got a phone call and she just said she fainted, and then basically I was talking to the paramedic, so that's when I got a bit worried. Well, I was worried, so full stop.
Hi.
Hi, how are you? How you doing? You all right?
It's an anxious wait for the first-time parents. The CT results will be back in a few hours, but the heart monitoring may take days.
If only had a warning like he did, I would have sit down, but it just happened.
Hopefully everything's fine. Scary, just the uncertainty of it all.
How long does it take?
What's that?
Lock eye.
How long does it take what to go? Depends on the person, I think.
Dr. Miriam Yasser's patient, 35-week pregnant Jonah, fell face first and landed on her tummy.
Oh, at least the baby's fine.
Her baby is okay for now, but Jonah and her husband are waiting for test results on her badly smashed face and on her heart. If she needs surgery, she may have to deliver her baby early.
Jonah, you've got a few little fractures in the bone around the eye, and because you've got a graze over the top there, sometimes that means that these things are a bit more prone to infection. Our plastic surgeons can keep an eye on it for us, okay? You seem quite upset. Are you okay?
Just want to go.
I know. And you will go home. We just need to make sure that everything's okay in the first place. Just make sure that you and baby are okay.
So what happens when she just stays here, or are they going to...
So we'll find her a bed up on the ward, and it's going to be a monitored bed so we can keep an eye on her heart. I'm just outside. If you think of any questions after I leave, you're welcome to grab a nurse or grab me, okay?
Jonah's had an awful day. She's woken up seemingly very well and ended up in hospital with 2 fractured bones and all this fuss around her heart and her baby. And now she's going to be admitted with more monitoring and more tests. I think they're both understandably very worried about what might be happening.
Now, what baby is this, a girl or a boy?
Girl.
Okay.
It's under IVF.
Dr. Miriam's patient, heavily pregnant Jonah, was rushed to hospital after suddenly collapsing face first at a train station. Thankfully, her unborn baby wasn't harmed, but Jonah fractured her eye socket and doctors feared she may have an undiagnosed heart condition. After 2 days under observation, doctors gave her the all clear. And not only has her eye healed, but a month later, she and husband Darren welcomed a beautiful baby girl.
So I see trauma's here. Let me know if you need anything.
It's been a full-on day in emergency, and Dr. Miriam Yasser is on her way to see a new patient, 25-year-old painter Brandon, who's fallen 3 metres from a roof.
Very tall. My name's Miriam. I'm one of the emergency doctors. I'm going to be looking after you today.
He was painting on the roof this morning. He's fallen, trying to get on the ladder, standing height 3 metres from the ground.
When I hear 3 metres, that makes me worry. That kind of height, you have to be prepared for the worst.
Okay, busy morning for you, hey?
Hey?
Busy morning.
Yeah.
Okay, so what were you doing up on the ladder?
I was about to hop down because I was painting the spout and then...
You were painting?
The spout, the
right.
guttering, and then I was about to hop down the ladder, lost my balance, fell back onto my heels.
Okay, so you landed on both your heels first.
When you get a fall from that height onto your legs, the force can cause fractures in the spine. If there's been a lot of damage to the spinal cord, there is potentially damage to the nerves.
You were able to get yourself up again?
Yep.
And what did you do when you got up?
Just relax a little bit because I was shaking.
Yeah.
And then just went to the hospital.
Okay, so you drove yourself into the hospital?
Nah, my dad did.
And I take it from your clothes, are you a painter?
Yep.
All right. So what we're going to do now is we're going to do an examination including your back, which means because we've got you in spinal precautions at the moment,
Yep.
we need to keep you lying flat on the bed just to make sure we don't move your spine more than we need to.
Yep.
Falling from 3 metres is a pretty significant
decent fall,
yeah. So you're going to have some CT scans as well. Do you have any pain?
My lower back there and my hand landed on my finger, I busted that.
Okay.
Any pain doing that? No. Any numbness or tingling in your feet?
No.
Where are you sore on your hand, mate?
My little finger, like this one here, the ring finger.
I'm just going to have a little squeeze. Is it sore there?
No, it's just sore at the top. That's all there. That's all there.
Can you help us with the lug roll?
Dr. Miriam gathers the team to roll Brandon on his side so she can check his back.
Press your arms. Still like a lot.
Give yourself a little cuddle, that's the way. We're worried that there might be more serious injuries to his spine.
1, 2, 3.
Brandon is complaining of back pain, so that is my main concern because a spinal fracture can potentially be devastating. Hi, I was just coming to see how you're going. He was standing on a ladder painting the top of a house, a gutter on the house, and he lost his footing, so he's landed on his heels.
25-year-old Brandon fell 3 metres from the top of an extension ladder while painting guttering. Emergency Dr. Miriam Yasser is concerned about Brandon's back.
We need to basically examine him from top to toe. If there's been a lot of damage to the spinal cord, Brandon climbs ladders for a living. He might not be able to do that anymore.
Fallen off ladders multiple times. I was up on the extension ladder and on the way down just fell off and just didn't land right.
Brandon was transferred from a local hospital to Royal Melbourne Emergency because of the distance of his fall.
I got my old man to drop me off down here, so he took me to the hospital and then he's like, there's no point in me waiting around. I'm like, oh yeah. He was like, oh, you'll be all right. I like the support, thanks.
We'll organise all your scans and things.
The CT scan will indicate to us whether or not he has a fracture in his spine. But not only that, it will look to see whether or not the force of the fall has caused any internal bleeding. We'll look at his chest. We'll look inside his brain to make sure that the force of a 3-metre fall hasn't caused any bleeding there.
10 more seconds here, nice and still.
Dr. Miriam has also ordered x-rays of Brandon's injured hand.
And put down just like so.
Yep.
All right?
Yep, cool.
The results of Brandon's scans are not what Dr. Miriam expected.
So, from that 3-metre fall, the only injury he's got is a fracture at the top of his left finger. Yep, his spine's fine. His head is fine. So he's lucky. He's lucky.
It's unusual that he has managed to escape a serious injury.
He needs to stop climbing ladders. I think painting is maybe not the job for him.
Yeah, it's me.
39-year-old Luke had a lapse of concentration cycling to work.
What happened today?
Just came through an intersection and then noticed a car I didn't spot the first time on the other side of the road. And when I put my brakes on, just overturned. Must have clipped my leg and went over the top and landed on the road.
Ah, right. Okay, let's see what this wrist looks like.
Dr. Michelle unties the splint applied by paramedics to see what the youth counsellor has done to his wrist.
Yeah, it's not meant to look like that.
No, it is not.
So that's why, because of the way it was sitting, I thought maybe a dislocation, but I'm pretty...
Yeah, we'll get you a bit more pain relief and we're definitely going to get some x-rays. Looking at Luke's hand, it's pretty deformed. So on the x-ray, I can see that Luke's wrist is pretty badly broken. All right, Luke, looking at your x-ray. So the bone, the radius, this bone coming down the end here, it's what we call off-ended. So it's totally come off and sort of displaced this way. So you will need an operation to fix it. So the radius, the bone from the elbow that runs in the forearm up to the base of the thumb, that's the bone that Luke has broken. And that distal bit of it has broken off completely and moved away from the end of the bone. It's likely to be floating there. There'll be a few ligaments still attached, but the bone itself has lost that connection.
Luke for Luke. G'day, mate. It's an easy name to remember.
Emergency nurse Luke Milligan prepares Luke to have his wrist straightened before surgery.
So we're going to give you 2 different medications today. We're going to give you ketamine and propofol.
Yep.
The reason that we give you both is that they sort of have a helpful effect for both dissociating you so that you're not aware of what's going on, and also making you sleepy and helping with pain as well so that you don't actually feel us putting it back into place.
Yeah, cool.
All right, and we'll be monitoring you through the whole thing.
Thank you, guys. See you on the other side.
Dr. Michelle sedates Luke,
So try to think of somewhere nice.
while orthopaedic registrar Dr. Vasant Sikka and emergency doctor David Camilleri will pull on his arm.
Hey, here we go.
Don't fight it, mate. Just relax into it.
Just take some deep breaths for me. When the bone breaks and moves out of position, the muscles, tendons all go into spasm and hold that in the wrong position.
I'm just going to take your wrist here.
So it's our job to pull against that force to lengthen the deformity and move it manually back into the right place. Let's see that strength of yours, David. Come on. That's the way. It requires David, my emergency colleague, to pull against Baz so that there is that resistance there. Otherwise, Baz may likely pull the patient off the table because it does require a lot of force to move these bones back into place.
You weigh more than me, so let me know when you're going to put your full weight on it.
Good job. Keep going. Good deep breaths. Anytime that a bone is broken and so badly displaced, it puts an enormous amount of tension on those nerves and blood vessels. So it's really important that we get that back into a good position because the longer that tension stays in place is the greater the chance of permanent disability.
How are you going there, Luke?
How are you going there, Luke?
Over in Resus Bay 5, cyclist Luke is under sedation as doctors pull his broken arm back into place.
Good job, Luke. Doing really well. Ketamine is known as a dissociative anesthetic.
How are you going there, Luke?
You're there physically, but mentally you go off to a happy place while the procedure is going and you're not aware of what's happening in your immediate environment.
You're okay, Luke.
It's all right,
It's
Luke.
all good. It's okay.
It's looking much better than it was. So a lot of that deformity is gone. So just putting a bit of antiseptic solution onto the wound. And now we'll put a bit of plaster of Paris to hopefully hold that in place until it can be fixed in surgery.
Well done, mate.
Worst bit is over. Well, I'm glad it's been lovely. Why don't you rest your head back? Yeah, just get some rest. Let the medication wear off.
Tom Cruise is dick, but...
Who's this?
Tom Cruise is dick.
I must admit, Tom Cruise is not in my top 10 actors, but I'd be happy to say good day if he walked into the room.
I'm back.
You're back, are ya?
Yeah.
Welcome back.
Where'd you go?
Still
Somewhere nice, obviously.
I do hear some funny stories. I've had people come out telling me they thought they were on a beach in the Caribbean. I guess that has to do with my accent.
The world was awesome.
There's no rush to come back to Earth, okay? No. You take your time. That was a little bit of fun, wasn't it? The sedation worked excellently. That's kind of where we want them. We don't want them all the way asleep. We don't want them all the way anaesthetized.
Let me know when you're going to put your full weight on it.
While having his broken wrist put back into place after a bike fall, Luke kept the team entertained under the hallucinogenic effects of the anaesthetic ketamine.
The world was awesome.
That's all we've got for you.
Surgeons implanted plates into the youth counsellor's wrist.
The biggest lesson I've learned is to leave on time, maybe even 20 minutes earlier so I'm not rushing. And riding maybe a different way, a different road, because that was a road I normally don't go down, didn't really have a bike lane, so sticking to bike lanes I think from now on.